Okay, folks, we're on to exam 4, covering chapters 10 through 12. We'll jump right in, and I'll try to keep this relatively short. I know that these are very, very long-winded recordings for you, but again, what I would recommend that you do is pause or listen. Listening is just as well, um, but take your time. Go over this and spend the hour it takes that for that to go through this review material. Anyway, onward. So first is chapter 10. It's property and motor vehicle insurance, something near and dear to all of our hearts, especially for you. It's motor vehicle insurance, auto insurance. It's a major pain. For most, it's one of those things that we see on a monthly, quarterly, semi-annual, annual basis, and we just shake our heads. Hopefully, meaning that we didn't have to use it. Anyway, so what is the idea, the purpose, if you will, of insurance? The purpose of insurance is to protect you and your family, if you will, against financial hardship due to hazard, accident, death, and et cetera, et cetera, et cetera. So insurance is protection. It protects people against possible financial loss. It's you're hedging your bets. Um, your life is fraught with gambles, and trying to we try to manage these as best we can, and that's where insurance comes in. Insurance comes in to kind of protect us against the unforeseen, but you know that it's out there lurking somewhere, right? So again, insurance is protection. There are financial trade-offs of not obtaining the right amount and type of insurance, and this can, of course, lead to disaster. So the first thing we're looking at, of course, are what? So again, what we're learning from this class is that we are going through that review process over and over and over again. So anyway, first off, we're looking at property and liability insurance. And we're looking at again, property losses. Property owners face two basic types of risk. Physical damage may be caused by such hazards as natural hazards, if you will. Not necessarily all natural, but fire, wind, water, smoke, etc. And the other threat, of course, has to do with something that someone actually does this. So this would be burglary, robbery, vandalism. Anyway, should get the idea. Liability protection is liability is legal responsibility for the financial cost of another person's losses or injury. This is you are taking responsibility, and this is you're at fault in essence. Uh, Further is that there's negligence that's associated with that, possibly failure to take the ordinary reasonable care, speeding, for example, and getting to causing an accident, as a result of speeding or reckless driving or something like that. Strict liability is present when a person is held responsible for intentional or unintentional acts. So this is your responsibility. Vicarious liability, it's another. It's more dependent upon other people's actions, being responsible for. Uh, you're a parent and you're responsible for your children, for your kids' actions. This is something to keep in mind, of course. But anyway, onward. So home and property insurance, homeowners insurance is covered um, for your place of residence, of course, and the homeowners insurance coverages um, uh, include the main component, if you will, of homeowners insurance is protection against financial loss or destruction to a house or your whatever, your residence, if you will. If fire or other damage prevents the use of the home, additional living expenses uh, would be covered as well, right? Or could be covered as well. This also includes such things as household belongings, furniture, and depending upon the percentage, if you will. Typically, it's 55 because they're used items, etc., and 55 up to like 75%, sometimes a bit more. So there's also it's what's called a personal property floater, and it covers the damage or loss of specific items of high value, right? So if you've got a violin that's worth, or some musical instrument that's worth several $1,000s, or in your garage you've got a classic car that is well worth the Kelly Blue Book value, for example. Anyways, these are high value items, jewelry, etc. So, um, so personal liability component of this in the homeowner's insurance policy protects you from financial losses resulting from legal actions or claims against you or your family members due to damages to properties of others. This coverage includes the cost of your legal defense, and kind of the overarching deal that's out there would be an umbrella policy. An umbrella policy is also called personal catastrophe policy, supplements your basic personal liability coverage. Medical payments coverage pays the cost of minor accidents or injuries on your property that occur on your property, and minor injuries caused by you, family members, or pets away from home. So these are all things that kind of fold, if you will, into that homeowners and home and property insurance. Renter's insurance is an adjunct. It's something that you can add on, of course. It's very similar if you are renting an apartment or whatnot. It's very, very wise to pick up renter's insurance. It's not expensive. It's very inexpensive. In fact, it's much less expensive than homeowner's insurance. So it's definitely something to consider. It's something very similar to this home and property insurance, this overall topic, right? So policy forms, of course, there are a zillion of different forms. You can walk through those on your own. But anyhow, you get the idea. So onward we go. And again, I promised you I'd keep this relatively short, and I'm working on it. So homeowners insurance cost factors. Most companies offer reduced insurance premiums if you have smoke detectors, fire extinguishers, if you bundle your insurance packages together, your homeowners and automobile insurance, and maybe even life insurance. I'm not sure if that's typical out there, but at least homeowners insurance and auto insurance is very, very typical. Okay. So the factors that cover or affect home insurance cost always has to do with what the location of the home. That's always there. You know, if you're in a quote unquote good neighborhood, then chances are that your home insurance might be a bit less, right? So that's one aspect of it. Type of structure would be if it's a brick home, they're generally speaking they're less so far as insurance costs than would be a frame, a wooden frame home or mobile home, etc. And lastly, what we're looking at is the amount that you actually need. So what that kind of boils down to is that do you want to what is it that you want? Do you want coverage, minimum coverage, maximum coverage, anywhere in between? And so, for example, minimum coverage would be that you would be getting um, what's called the actual. It's not the, it would just be replacement. So, meaning if you have if a home that's valued at $100,000 for the structure itself, for example, and you would get received $100,000. But the problem with that, of course, is that to replace your existing structure might be much more. So you've got to consider these things too to have additional insurance that would pick up on that. Anyhow, you get the idea. So onward, so reducing those home insurance costs. Most companies offer, again, those reduced insurance premiums that I mentioned before. So there's significant savings that could be involved with that. So auto insurance. We're looking at automobile insurance coverages. Now we're moving on to autos, of course. So it's a financial responsibility. It requires drivers to perform, typical in most states now, ability to cover the cost of damage or injury caused by an automobile accident. It's a basic idea. Main coverage of insurance, auto insurance, can be grouped into two categories: bodily injury and property damage coverage. So splitting those two categories out: bodily injury and property damage coverage. Motor vehicle bodily injuries, for example, the coverage is associated with that. So bodily injury liability is for the risk of financial loss due to legal expenses, medical expenses, lost wages, other expenses associated with injuries caused by an auto accident. So the typical breakout in terms of actual coverage is it's 100 and 300 is the kind of the expression. Bodily injury coverage, for example. So a driver would have a limit of $100,000 that could be paid to one person in an accident for claims. In addition, there would be a $300,000 limit for all bodily injuries claimed in a single accident. Medical payments cover the cost of health care for people who are injured, including yourself, of course. If you are in an accident caused by a person without insurance, uninsured motorist protection covers the cost of injuries to you and your family. But in most states, it's not property damage, so it's not you've got to go after the uninsured, if you will. The uninsured coverage provides financial protection when another driver, again, doesn't have full coverage or some less than or no coverage at all. Michigan, for example, is a no-fault state and provides for drivers in an accident to collect medical expenses, lost wages, and other related costs from their own insurance company, right? So property damage, when we talk about property damage, we're looking at, so when a damaged property of others, property damage liability protects you, the property damage liability insurance, if you will, protects you against financial loss, including vehicles, street signs, things people don't consider. Lamppost buildings, hopefully not too much, but there's often other damage that's done to, running off the road and tearing up someone's lawn, for example, because of sliding in the snow and ice. Not that that's ever happened before. Anyway, you get the idea. So when your automobile is involved in that accident, collision insurance pays for the damage to the auto regardless of who is at fault. But if another driver caused the accident, typically what happens is that your insurance company would go after that person and or their insurance company to deal with that liability on the other driver's that it's the other driver's fault, if you will. So comprehensive physical damage covers you for such risks as fire, theft, glass, breaking. It happens, right? Broken windows and so on, broken windshields or hitting animals. That never happens in Michigan, right? So wage loss insurance will reimburse you if you have income loss due to injury in an automobile accident. Towing and emergency services, of course, are out there as well. So onward, automobile insurance cost, is directly related to coverage amounts such as factors as the vehicle, your place of residence, your driving record. It goes on and on and on. So the amount of coverage, every state currently requires it, or they at least encourage automobile liability insurance coverage. I think everyone does now. So just as medical expenses and legal settlements have increased, so too has the cost of automobiles, making higher property damage coverage necessary. So auto insurance premium factors that would roll into this. What type of auto it is? Is it a brand new Mercedes that's $150,000, or is it an old beater that's worth $500? All these things are things to consider, especially today, again, with higher prices of vehicles. So in most states, your rating territory is a place of residence. So if you live in a higher premium area, typically it's because they experience higher premiums in that area, more claims, if you will, against your insurance. So driver classification is a category based on driver's age, sex, marital status, driving record, driving habits, etc. And this is a tough one because when people are young, the insurance rates are typically much higher. Anyway, and it all has to do with the pool, the insurance pool. So again, the assigned there's also what's called an assigned risk pool, and that's for folks that are not. They've had many accidents. They have a very poor driving record, and the cost is prohibitive. So the main thing, of course, is to keep in mind is to try to drive reasonably sane. Anyway, so onward. Rates and services vary among insurance companies. Most companies in the same area, premiums can vary. Even in the same area, premiums can vary significantly. So shop around. Under 25 year old drivers can qualify for reduced rates by completing driver's training programs and maintaining good grades in school. All these things that they add into this equation, if you will. Installing various not safety devices necessarily. Yeah, of course you'd have if you have airbags and so on and so forth, the cost is a bit lower. But beyond all that, if you have theft, if you have alarms, and they're relatively inexpensive, that's worth considering, even if you don't have one in your vehicle. Discounts are available for a variety of areas and for a variety of reasons. Again, as I mentioned before about bundling with your homeowner's insurance, etc., all the things that kind of go along with it. Typically increasing the deductible, meaning results in lower premium. So for example, going from a full coverage comprehensive insurance to a $100 deductible, may reduce your premium by a significant amount. Anyway, that's it for auto insurance. Onward we go to Chapter 11, health insurance, disability, long-term care insurance. These are all things that are either, again, you have auto insurance and then you've got healthcare insurance. These are things that we think of all the time, no matter what your age is. And it's something that you have to deal with on a very regular basis. Okay. In addition to that, there's disability insurance and long-term care insurance, which we'll talk about a bit. Anyways, I'll just really briefly talk about it. Is that health insurance is straightforward: Blue Cross, Blue Shield, etc. All the stuff that's out there. Disability insurance is insurance that's set up if you become disabled and you can't work, right? Anyways, and we'll get into that as we go forward as well. Long-term care insurance. This is set up for folks that have to go into nursing homes or assisted living, into those type of arrangements, and they are extremely expensive, and we'll get into that. And this is one thought on insurance. The earlier you start to think about these things, the earlier they buy these policies, for example, even for like a long-term care insurance, you don't think about it when you're 20, 30, 40 years old oftentimes. But the earlier that you buy into this type of insurance, long-term care, the less expensive it is. Anyway, so healthcare costs, soaring cost of healthcare. We don't need to even talk about that, but there are very different reasons why it's gone up, and we'll kind of get into that in just a second. But again, healthcare costs, you can break it down into three different categories, if you will. So there's the rapid increase in medical expenditures, high administrative cost, very high administrative cost, by the way. And you also have to consider the folks that aren't covered, And that, as it is with auto insurance, if folks are not covered, they still receive health care, but the other folks kind of have to pick up at least a portion of that. So again, why does the healthcare cost so much? The high and rising cost of healthcare attributable to many factors because of third-party private health insurers and government pay so much of the nation's healthcare bill. Hospitals, doctors, and patients too often lack the incentive to make the most economical use of healthcare services. The further you are away from the bill that you receive, the less inclined you are to be concerned about it. So, what is being done, if you will, about healthcare cost, if you will? So, what concerned groups such as employers, obviously, unions, health insurers, healthcare professionals, consumers have undertaken a wide range of innovative activities to reduce the certain costs, if you will, that are associated with healthcare, preventive maintenance and preventive, healthcare, increased gym, pushing people toward gym memberships and so on and so forth. So what can you do to reduce your personal health care costs? The best way is to avoid the high cost of sicknesses to what? Stay well. Learn to minimize through intelligent self-care that need for that medical attention. Exercise, increase the exercise. Try to get your 8 hours of sleep. All these things that kind of go along, they're pretty they're self-evident, if you will. So again, correct diet, not overeating, not overdrinking, not drinking too much, not smoking, getting enough sleep, getting again back to the exercise. All these things that are very, very important. Anyway, the health insurance and the financial planning that goes along with that is that. So what do we mean again by, just one sec. Sorry about that. Anyway, what do we mean again by health insurance? Health insurance includes both medical expense insurance and disability income insurance. All these things kind of flow together, if you will. And so we'll start with group health insurance. Most Americans are in some type of a group health insurance program. In fact, it's probably about 85%. This is group health through your employer or your parents' employers or significant others, etc. And it's a group plan. They vary significantly, again, from group to group, from plan to plan. Individual health insurance coverage, again, it varies from company to company. And how do you supplement? You can also go about supplementing your group insurance. And that means is that if there's not enough there, you can add things on, such as it fails oftentimes to cover a lot of your medical bills, hospital bills, doctor bills, surgical charges, etc. So you would have to buy supplemental plans, if you will. So in supplementing your group insurance, consider health insurance benefits that your employer-sponsored plan provides to you, to your spouse, for example. Most group policy contracts have coordination of benefit provision. That means coordinating benefits between your health insurance and also your auto insurance that covers that speaks to the accident, injuries that are associated with getting into accidents, etc. So it brings those together, it coordinates those benefits. Medical coverage in terms of divorce, what happens is that if you're divorced, if you get divorced, not that I'm telling you to get divorced or even to get married or whatever, but the point is that there are also some added insurance that would be available to folks that are separated, that are divorced, and it's what's called COBRA, and that's continued access, if you will, to these group health plans, and they get very, very expensive. Anyway, so types of health insurance coverage: hospital expense insurance, as the name implies, insures and pays part of all of hospital bills associated with room and board and other charges, surgical expense insurance, pays all or part of the surgeon's fees and operations, physician expense, pays for office visits and pay for physician's care that does not involve surgeries, if you will. So kind of the bigger umbrella of the whole thing is major medical expense insurance, major medical. The large expenses associated with serious injury or long-term illness. And there's comprehensive major medical insurance. These are all things to walk through, if you will, with your plan. Comprehensive major medical is a type of major medical insurance that has very low deductible amount and is offered without any separate basic plan. So it's kind of an umbrella policy, if you will. Hospital indemnity policies. Hospital pays benefits only when you're hospitalized, but these benefits are paid to you in cash. Dental expense insurance. Dental expense insurance provides reimbursement for expensive dental services and supplies. Usually they're kind of limited, like a preventive care, and they pay. I don't know of any program that pays for like orthodonture and so on and so forth, but you get the idea. Vision care has also been added into the mix for glasses and contact lenses, etc., where they pay for a certain amount of coverage, if you will, per year, if you will. So other insurance policy, dread disease, cancer policies, a lot of others involve a lot of scare tactics because dread disease, cancer policies, certain people are going to get them, and there's not much you can really do about them, and they're extremely expensive. Long-term care insurance is what we talked about kind of earlier on, and long-term care is it's if you're not able to stay in your home, or if you need constant medical care, or if you need close supervision, people that have Alzheimer's, dementia type of situations, people have to live and move into nursing homes. Nursing homes are very expensive. I think they're on the order of close to $100,000 a year in some cases today, and long-term care insurance can go a long way. So again, the idea is that consider these things even when you're younger, that long-term care insurance in particular. Anyway, onward. So major provisions in healthcare policies are eligibility, assigned benefits, inside limits, the whole laundry list here, service benefits, benefit limits, exclusions, limitations, coordination of benefits, guaranteed renewability, so that you can renew your insurance annually or, kind of going forward. These are just terms that you have to be aware of. Cancellation and termination. So with health insurance, as with everything else, there are trade-offs. Benefits of health insurance policies to consider: reimbursement versus indemnity, inside limits versus aggregate limits, deductibles, co-insurance, out-of-pocket limits, benefits associated, benefits based on reasonable and customer charges. Will your physician accept the payment in whole coming from your insurance company, or are they going to charge you above and beyond? These are all things to be concerned with, if you will. So which coverage should you choose is what it comes down to, which ideally you should choose a basic plan at least, and a major medical supplementary plan, or you should get a comprehensive major medical policy that combines the value of both of these in a single policy. You kind of bundle them together, basic and that major medical piece, bundled together to form that comprehensive major medical policy. Again, when you're young, you don't think about these things, frankly, because in most cases you don't need them, but it's still something to consider. So private sources of health insurance and healthcare. Of course, there are private insurance companies. Most private insurance companies sell health insurance policy to employers, which in turn offer the benefits to employees, and their dependents as some sort of a fringe benefit arrangement that they have with those employees, their benefits package, if you will. Hospital medical service plans, those would be such things as Blue Cross and Blue Shield. Blue Cross pays for hospital care, so Blue Cross portion of it is hospital care. Blue Shield pays for surgical and medical services performed by physicians. Managed care refers to prepaid health plans that provide comprehensive health care to members, including such things as like, well, HMO. Well, I was thinking more of a, well, anyway, we'll move on. HMOs are some along those lines, and an HMO is a health maintenance organization. It's a health insurance plan that directly employs or contracts with physicians, etc., and to manage your care is really what it is. So there's your primary care physician as your is the gatekeeper, and they send you to other folks, and you have a prepaid monthly premium, and typically there's no deductible associated with HMOs, health maintenance organizations. PPO is kind of the next step, but it puts you in more control. And PPO means that you can go to, you have your primary care physician, then you've got a laundry list, or a list, if you will, of other physicians that you can go to, or medical care that you can seek within the framework of that PPO. If you go outside the PPO, it becomes more expensive. Anyway, it goes on and on from there. Point of service plans, they're kind of a mix, if you will, of HMO and PPOs, and home healthcare agencies providers furnish healthcare providers, home healthcare providers furnish and are responsible for the supervision and management of preventive medical care in the home setting in accordance with a medical order. What that means, of course, is that there's home nursing, etc. Employer self-funded health plans, there's a number of those that are available out there that you can pick up, and there are what's also called new healthcare accounts. There would be HSAs, health savings accounts. There are also FSAs, and there's another one too, but the health savings account, you puts money into your pocket and you kind of manage your own care. You buy a very high deductible plan, and you can set aside funds kind of going forward, if you will. Okay, onward. So government healthcare plan programs. First is Medicare. Medicare is for folks that are 65 or older, and typically, and also people with any age would have permanent, like organ transplants, and also picks up certain types of disabled folks, if you will. So there are 4 parts to Medicare. Hospital insurance benefits. Part A helps pay for inpatient hospital care, inpatient care in a skilled nursing facility, home health care, and hospice care. That's typically picked up, if you will, through that Medicare. Part B helps pay for medical insurance benefits, and Part B helps pay for doctor's services and other variety of medical services and supplies that are not covered by hospital insurance. Okay, so there are others as well. There's Part C, and this is kind of an adjunct, and again, an add-on. Medicare Choice. This new plan may be less expensive than the original Medicare, and typically, and then there's also Part D, and that has to do with prescription drugs. And so there's A, B. Typically, most all people 65 and older are eligible for, so long as you've worked a certain number of quarters, are eligible for Parts A and B. C and D, you have to pay a bit more into to pay for those for that coverage, if you will, out of pocket. And typically they have riders, if you will, that you can pay a little extra a month to cover those additional costs, that C and D, if you will, that Part C and Part D cost that would be associated with older folks. Okay, and so let's see, we have I want to just cut right to the chase. We've talked about we'll go right into Medicaid. So Medicaid insurance is for folks that um, are folks that are the word, lower income people, and there's an add-on to that for if you so that would be for adults, for example, Medicaid. And if you're a child or if you're a dependent, for example, you would most likely be eligible for the child portion of that or the CHIP program. Anyway, the idea again is that these are coverages that are increasingly important, fortunately or unfortunately, I guess, depending upon how you look at it. These are very expensive. So Medicare is for just in general for people that are 65 and older. Medicaid is for people that are less than 65 that cannot afford insurance, for example, cannot afford typical health insurance. Problems, of course, with that is that there are significant um, uh, cases of fraud and so on and so forth. Anyways, we'll just move on from there. These are things, all things to kind of consider. Moving on to disability income insurance that we kind of referred to before. So disability income insurance benefits provide regular cash income lost to employees as a result of accident, illness, or pregnancy. General disability income policies are divided into short-term, long-term. So definition of disability. There are different types of definitions of disability. Some are stricter than others, meaning if you can't go back to your job as a truck driver, it doesn't mean that you couldn't necessarily do some other work, right? For example. So it all depends on how that's defined, how that disability is categorized. So lots of trade-offs to consider when you're doing the disability insurance. When you're applying, if you will, or thinking about getting disability insurance, there's typically a waiting period or what's called elimination period. How long those benefits last, the amount of those benefits, and if there's an accident and sickness coverage that goes kind of along with that, and always very important, the guaranteed renewability. So the sources, if you will, of disability income, there are three major sources. First would be your employer, those employer pay plans. Second would be Social Security, the Social Security Disability Insurance SSDI portion of that. And then workers' compensation. The availability extent of these and other, it varies. It varies significantly how much is covered and all the other things that we had mentioned before. So you've got to sit down and kind of determine what it is that how much you want. How much do you want? How much disability and income do you need to have 100% income if you become disabled? Can you wait long enough for Social Security disability comes into play? Do you have reasonable assurance that you would be? These are all ifs. If it worse comes to worse, if you will, right? So these are all things to consider, and you've got to take a little bit of time and walk through that. So onward, chapter 12. We're looking at life insurance. So, in addition to the previous insurance, the auto insurance, the homeowner's auto insurance, health insurance, disability, long-term care insurance. Now we're looking at taking up the next step. We're looking at life insurance. And so, what is life insurance? So, basically it is a risk-sharing group where you're purchasing a contract. The insurance company promises to pay a sum of money at the time of your death. So this is the kind of the worst case scenario, or typically, if you will, in return for the insured agreement's payment, the monthly premiums that you would be kicking in. So this is the payout to whom? To your beneficiaries, to the folks that you leave behind. That's the purpose of life insurance, and it's protect someone else. It's for someone else. It's for income going forward for someone else. So the principle, if you will, of life insurance, and it's from records, records covering many years, including millions of lives. These are mortality tables that are, by the way, it's a good job if you become going into insurance in terms of being an actuarial, the person that actually puts these tables together and goes through these probabilities and so on and so forth. It's a very it is in a way, it's a very interesting job. Mathematically oriented, it's of course, but just the idea is that you're trying to determine how long the likelihood that a person will live. So how long will you live? You can look at your life expectancy, and in general, women live significantly longer than men. Something to keep in mind. Life expectancy, and there's all kinds of linkages and walk through, but there's education. So there's a correlation, of course, between, or you would expect there to be one actually, between level of education and life expectancy, because the more educated you are, the more you'll have kind of a handle on things in your life where you're avoiding some of the risks and so on and so forth. And hopefully not smoking too much, eating too much. The more educated you are, the more aware of these things you are, if you will. So onward. So determining what your life insurance needs are. Should consider some of these facts. Do you actually need life insurance? If your death would cause financial stress, if you're unmarried, for example, who do you have to take care of? Seriously, you have to think about these things. Whereas if you were married, had children, or if you had somebody that you needed to take care of after you were gone that would need your help, then you definitely want to consider life insurance. Okay. Anyway, so determining what those life insurance objectives are before you consider the types of the insurance policy, answer some questions. So, how much money do you want to leave to your dependents, the folks you leave behind? When would you like to be able to retire? How much will you be able to pay for your insurance program? All these things factor in. So the retirement piece of it is that if you'd like to retire at age 65, if you have a life insurance policy that provides enough income after you're gone, then chances are you might be able to retire even a little earlier than 65. All these things they come into play. So you have to by estimating your life insurance requirements, we're looking at different methods. They're just very straightforward. There are 6 general methods. One is the multiple of income method, is a range between 5 and 8 times your income. The easy method, typical family will need 70% of wage earner's salary for 7 years before it adjusts to the financial consequences of wage earner's death. 70% because of taxes, for example. You would not be subject to taxes for insurance policy. The DINK method, and what that we walk through, is if you have no dependents and your spouse earns as much or more than you, then you have simple insurance need. All you need to do is ensure that your spouse will not be unduly burdened by debts should you die. Covers your burial and so on and so forth. Non-working spouse method. So if you've got a spouse, a stay-at-home spouse, estimate how much life insurance homemaker should carry, multiply the number of years before the youngest child reaches 18 by 10,000. So you've got a child that's 8 years old, and we're just saying that the child costs $10,000 a year, basically is what it is. And to raise, so that would be $100,000, for example, if you have one child, or the youngest of your children, if you will. Family need method, again, these go on and on. There are all kinds of calculators that are available online for you to kind of walk through all these different scenarios, if you will. Okay, so onward we go. So the different types of life insurance companies and policies. There are two basic types of insurance companies. One is a stock life insurance, and the other is a mutual life insurance. So stock is a typical corporation you'd expect, whereas a mutual insurance company is that it's owned by the folks that are actually paying the premiums. So anyway, types of life insurance policy. There's term life insurance policy. This is the basic one. Term life insurance is protect for a specific period of time, usually 1, 5, 10 years, etc. And they're limited because you have, so if you're, let's just say you're 50 years old and you can get a 20-year term policy. So when you're 70, if you live through that, so the best for yourself, of course, is that you live through the end of the term of the policy and the policy expires and you're 70 years old and you've lived that long. So you needn't be, so you wouldn't have to exercise that policy. Policy expires and you go on. There's what goes on with that is the renewability option. So that means that if you turn 70, for example, in that 20-year policy I just mentioned, you're able to re-up, you're able to renew the policy. Conversion policies, if you have convertible term insurance, you can exchange it for a whole life policy. You can roll that into a whole life policy, and we'll get to that in a minute. And there's decreasing term insurance, and over you pay less. It's kind of as you go forward. Pays less to the beneficiaries, if you will, as time goes on. The closer you get to the end of the policy, the less it's going to pay the beneficiary. And all these things are kind of standard operating procedure, if you will. That's term. Whole life insurance, the most common and permanent life insurance is whole life policy. It's also called a straight life policy or an ordinary life policy in which you pay a specified premium each year for as long as you live. Common features include cash value and there is guaranteed cash value on your whole life policy, for example. Non-forfeiture clause allows you to not to forfeit all accrued benefits, so you maintain those benefits. Several types of whole insurance policies have been developed. Populars are limited payment policies, variable life insurance policies, adjustable life insurance policies that are, you can again adjust. And lastly would be the universal life. It's the policy that combines term insurance and investment elements, and it's actually just a more flexible version of whole life insurance. So other types of life insurance policy, group life insurance policies through your employer, etc. Endowment life insurance provides coverage from the beginning of the contract to maturity and guarantees payment of a specified amount to the insured. Credit life insurance is used to repay personal debt should a borrower die on your mortgage, on your vehicle, so on and so forth. Industrial life insurance is the least popular form and appeals, and it's just actually insignificant at this point. So, what are the, moving on, important provisions in life insurance contract, for example, policy reinstatement, lapse policy that can be put back into force. So if you forgot to pay your premiums, for example, are you able to kind of get back in along the same lines as the grace period, automatic premium loan if the insured does not pay their premium within that grace period? All these things are all part and parcel of the same thing. Guaranteed insurability option provides intervals when the insured can obtain additional coverage without proof of insurability. So there are a lot of different things that go along with this. Again, some common provisions regarding clauses, non-forfeiture clause. The clause prevents the forfeiture or the surrendering or giving up of accrued benefits if you choose to drop the policy. Incontestability clause, that provision that states the insurer cannot dispute the validity of a policy after a specified period. The suicide clause, all these things are they're tough to swallow, but again, there's a proviso, if there's a provision, if you will, that if a person commits suicide in a certain period of time, it determines whether or not the premium will be paid or the benefit will be paid to the beneficiaries. Some common provisions regarding payments from life insurance policies include very straightforward. Is you have to name your beneficiary. Who do you want to benefit from that? Misstatement of age provision. People never lie about their ages. Yes, they do. Strange as it might sound, even with insurance. Policy loan provision. A loan from the insurance company is available based on the value of your whole life or endowment policy. Second to die option, policy that insures 2 lives instead of 1. So anyways, so some common provisions regarding riders, if you will, to life insurance policy. The company will waive premiums if an insured becomes totally or permanently disabled. So if that's a disability piece that kicks in, accidental death and death and dismemberment usually is what it's called. Benefit, the insurance company will pay twice the face amount, so double indemnity if they die due to an accident. COLA, or cost of living protection, is that if there's inflation, which is likely and has been the case in the past, then it would increase the amount of the policy, if you will. Accelerated benefits, life insurance benefits will be paid to insured still living if there's a terminal illness. Again, these are all different things that kind of go along with it. So actually buying your life insurance, getting into that. So consider your present and future sources of income. Always think about these things. Other savings and income protection that are already in place. You know that you're going to be getting some Social Security. You may already have group life insurance, etc. So who do you buy your policies from? You have to find somebody that is reliable, and there are different organizations out there. So the rating insurance agency that you typically think of is called AM Best, and there are several other rating agencies. And you want to make sure that your insurance company, because remember these are financial institutions, has enough in terms of premiums going in to pay the expected amount of benefits going forward. So you really have to be careful with this, and you've got to make sure that you find a reputable firm. This is all about security at this point, so keep that in mind. Comparing the cost policies, the price of life insurance policies varies considerably among different insurance companies, and you're going to encounter an agent, and you want to make sure that you ask your agent certain things. So there's one thing that you want to ask your agent for sure, and that is so you can compare apples to apples, interest adjusted indexes. And what that is that's so that you can, if you go to a Progressive, or if you go to an Allstate, or if you go to Farmers, or et cetera, you'll be able to kind of assess them based again on this interest adjusted indexes that are available that your agent would have to provide you, because your agent member is acting in your best interest, and you have to make sure that happens, because you don't want them just to give you whatever policy that they're, for the company that they're working for. You want to get the best policy for you. So obtaining your policy itself, so the insurance company determines your insurability by means of the information that you provide. Typically, you have to have a medical examination. So again, this is why it's important to consider these things when you're younger, because when you're younger, typically you are what? Healthier. The older you get, the more likely that you would have health issues to deal with that would crop up, if you will, on your medical examinations, and all the other things go along with it. So examine the policy. You have what's called a 10-day free look period, meaning you can, even if you sign up for a policy, you're able to consider it for 10 days. Go through this. Make sure you go through every word, and make sure that your agent can answer every question that you have. I'm very serious about this. You have to know the fine print. You've got to go through every detail. So again, the proceeds, so well-planned life insurance policy can end up being two things. One, it can provide funds to beneficiaries upon death of you, unfortunately. Secondly, it provides funds, um, it can provide funds to the insured when you're living, depending upon what type of insurance that you get. So the death or survivor's benefit that comes in, most common settlement options are lump sum payments, proceeds are left with the company, limited installment payments, and life income option. So that's kind of an annuity type of a thing where you're paying, uh, you would be paying the beneficiaries over a period of time. Think about the lottery. Lump sum payments are always the ones that you want. Anyways, we'll leave it at that. So anyways, I think that's kind of wraps it up. There are a few other items. Um, the one thing I do want to make note of is that when you're switching, if you want to switch policies, you have to be extremely cautious. So if you have insurance with the company for a period, this is why group life insurance is great, because it's usually typically pretty inexpensive with your employer, but you really ought to consider having buying your own personal policy. And the reason I say that once again is that it's very, very difficult to switch companies to get new life insurance, if you will.